let's move on to this a little more deeper with respect to its impact, a little more in details to the healthcare organizations, and rather the implementations. Let's get to the core of this item, right? So again, I'll turn up to Mark over here. So Mark, Onyx has got these the capabilities, the solutions that we have, right? How, with respect to the platform that they have, with respect to the FHIR implementations, with respect to the thought leadership that they have. I mean, would you just a little bit describe on all of those capabilities, credentials that Onyx has, and how these healthcare entities should expect it to be, if they decide to work with you?
Okay, so just a little bit of context.
Sure.
Onyx, I think, was really the first FHIR interoperability platform that was really built for payers primarily, right? A lot of FHIR originated in the provider community and was oriented around providers. And so the work we did, with CMS in building out the explanation of benefit to be able to communicate information to patients, to members, was really, that first step into the payer world. And there's a lot of good platforms out there. We actually co-built our platform with Microsoft, and we use a lot of their technology. They have some great health care technology like Azure Health Data Services. But we built this from the perspective of what makes it easy for the payer. And yes, you can go and buy a FHIR server, and you can then work out how do you get data into it, and then how do you let people have access to it securely, and how do you deal with the various requirements? Because yes, everybody says, oh, we support FHIR, but the secret is it's about the implementation guides that define specific use cases, and those keep evolving. As you will see, between 9115 and 0057, you've now got more claims to deal with. You've got more resources in the clinical side. All of this means that those basics, you want somebody to deal with the general housekeeping of keeping all that up to date. So you, as a payer, can focus on where you really deliver real benefit to your members. And so that's what we've done. We've basically assembled all of the pieces that are necessary, from the ingestion pipelines, make it easy for payers to understand what they need to give us. We'll make it turn into the magic of FHIR, deal with the API platform and all the consent management. And oh, by the way, here's out of the box a developer portal. Oh, and a synthetic sandbox so that you can test your apps, Mr. Developer. All of that basically comes out of the box, so we can deploy for a health plan now in something like about 12 weeks. Whereas if you construct it yourself, you could be talking 18 months.
That's glad to know that you've thought about this little holistically and not like a tactical approach in terms of building this ability.
And we're thinking about what's the next round of changes, like how are you going to support TEFCA integration? How are you going to start to do digital HEDIS, because that's moving to FHIR as well? All of these become complementary. And then how can you actually use these building blocks that CMS is making you put in for real other business purposes, like value-based care and risk reward contracts with providers? You need to provide them different data. You can use these building blocks for that. We've been thinking about this for years.
So eventually your product ensures that, as I said, right, think about this little holistically rather than a tactical move at this point of time. So would you just, how do you go ahead and differentiate this, right, with respect to what other solutions do you have in market? If you have a perspective on that, that would be helpful for our audience to understand.
How do we differentiate? Well, like I say, we focus from providing compliance solutions that are built on a comprehensive FHIR interoperability platform. Whereas a lot of vendors out there, it's either I'll build this as a custom build for you, okay, and then you've got the ongoing management of that. We've had clients come to us and say, can you provide this as a managed service? Because yes, we built it the first time, but everybody that built it has gone to the four winds and we cannot maintain this. So it's this focus on really making it easy for our clients to be able to operate this platform and get value from it, that I think is one of our key differentiators. It's what put us basically, last year we came into class in the CMS payer interoperability category at #1. And that is something we take a lot of pride in, because that is really about our clients being happy to tell class what sort of a job we did.
Great point. Great point. So let me turn up to Manju. Since now that you have spoken about the more capabilities from a platform standpoint, Manju, what additional value do you think LTIMindtree would bring it to your customers when it comes to these interoperability offerings that would be a little more differentiated in itself as a whole?
Sure, Nitin. So, as I already mentioned, these implementations of interoperability solutions is a fairly complex undertaking. I mean, these are, like I said, very, very complex integrations and large program management and so on. So one of the things that will make this successful is that holistic view I was talking about, right? Understanding, this not just as a, hey, the last final rule came out. Do I understand that is not going to be enough? You're going to look at, that in conjunction with the prior rule, 9115F, and the integrations, the EMR, like I said, the whole ecosystem and so on. So I think we bring that capability. LTIMindtree brings that capability. We were one of the earliest, in fact, to do the analysis of the final rule, again in conjunction with the prior rule, and coming up with this holistic view. That'll help our payer customers to kind of get jump started with their initiatives. So this view is what has resulted in our offering named Interop Connect, which is powered by Onyx, which I agree is unarguably the #1 platform in the industry today. So this combination is what makes this offering really powerful. Now, the Interop Connect offering is backed by a pretty extensive experience on similar initiatives that LTIMindtree has executed in the past. We've done a large number of projects involving FHIR implementations for BCBS associations, PDT, the provider data transformation projects. We've done FHIR-based exposure initiatives for hospital EHR data, for health apps. We've done several FHIR enablement projects for Medicaid IT platforms. So I think all this, has given us that tremendous experience in understanding FHIR very, very well. And then I think, last but not the least, I think it's very important for initiatives like this to have the right talent pool, and which is what we've built over years with all this experience. We have over like 3,000 plus middleware consultants. And again, these are not just technology consultants. A large majority of them have that intersection of technology and healthcare kind of experience working with multiple clients. And just one other thing I'll probably add to wrap this up is, I know this is not quite directly relevant to the US healthcare market, but still very, very relevant when it comes to FHIR implementations. Is LTIMindtree is the company behind the Ayushman Bharat Digital Mission, which is the initiative of the government of India to provide healthcare access to every citizen of India, the largest in population in the world. So you can imagine the scale and complexity of that. The last I heard, we had like 670 million enrollments, members, with the 420 million health records being moved around. So that just tells the kind of complexity in integrations and the FHIR implementation challenges that we might have faced. So like our team say, there is probably no challenge with FHIR implementations that we wouldn't have faced and fixed with this large implementation that happened for this initiative. So all that experience is what we bring to our engagements with the clients.
Thanks, Manju. I think glad that you brought the parallels that Ayushman Bharat had to deliver in India in terms of scale, but there's a lot more similarity in what US is trying to achieve as well. So I'd like to check with Tony here, right? Tony, been there, kind of done that, right? Would you please share some of the experiences of the implementations that have happened on the 9115 side of the patient access one? And would you share some of the key learnings, success factors from those projects? And Mark, you can also
thank you.
at your point. Sorry.
Yeah, Mark can certainly add a lot more color commentary, but I think Mark made a point a few moments ago that payers are very much have been tied to the claims side of the equation. X12 transactions, they've been doing that for many years. They've been now getting into FHIR and recognizing how much more capability that brings them. And I think a couple of things that I saw from Onyx over the past several years that I think are important as we move along into the next phase. Number one is the knowledge that they have. People like Mark and others have been involved in developing the implementation guides. So they were there at the beginning. They understand the health plans issues. They understand the business processes, but they also understand the technology and the underlying issues that come up. Second thing I think that's been important, and it sounds like with Mindtree the same thing, is getting involved with the customer early and often, staying very customer focused. I saw when the original mandate came out under the 9115, the Onyx people were there. They were working 24/7 to make sure that their customers would make the mandate. And they were there to work with them, to help train them, to help bring them on board. And I think, that's something that, as was talked about a few moments ago, there's a lot of companies that are starting to play in this space or have played in this space, but they're trying to, at times, either do a customized approach or force feed it into something they have already, as opposed to really looking at where the customer is in the life cycle and where they need to go. And I think the other thing that I've seen and I saw in these initial implementations is the flexibility. None of these implementations goes perfectly. There's always things that happen along the way. And if you have the knowledge and experience and you build up the relationship with the customer, when things happen, you have the flexibility and knowledge to make sure that any issues that come up are taken care of. And I think that was one of the major things I saw with Onyx from the CEO on down. They were, they were heads down and making sure that the customer met the mandate, but also that the customer understood beyond just the mandate, as Mark pointed out a few moments ago, what it meant for future implementations and future businesses processes.
Yeah, a couple of things to add to that, Tony. I mean, great points that you made. When we looked at this, we also recognized that when you've seen one payer, you've seen one payer, and everybody has different components. And so part of this is understanding where's the right place to make changes or configuration changes, not build it from scratch changes. FHIR is all about the use of standards, whether it's OAuth or Smart on FHIR. There's things like UDAP coming along, the FHIR standard itself. Being different and providing a custom way of doing things as we go into this next rule is not an advantage. It is a positive disadvantage for payers. If I, as a developer, have to jump through a different set of hoops for payer A than payer B, I'm going to think twice about, do I want to take that step? The advantage we did in building a developer portal that is a shared capability is that a developer can come in, they can register once, they can connect to the sandbox, they can test their apps against certified APIs so that they're going to act the same way. They can then request access to any one of our customers, and they know it's going to work the same way. And that means that they can connect with a dozen different clients for basically the same level of effort. When you think about prior auth and the fact that there are 1,000 payers out there that are going to be implementing this over the next 2 years, and there are millions of providers, and thousands of EMR instances that are going to have to connect to them. The way we did consumer app registration is simply not going to scale. And so having your custom way of doing things is going to put you at a real disadvantage if you really want to take advantage of the potential transformation that can come from the use of these APIs.
Wow, couldn't have agreed more than that. Fair point, absolutely. Finally, I want to check with Manju. I mean, though you did bring out some of your core areas, right? But how would you like to summarize some of the strengths that Interop Connect would bring onto the table for the eventual health customers, if they're calling us and if they want to engage with us?
Sure. And again, if you're Nitin, I guess referring to how Interop Connect with Onyx at the core, basically as a how do these two come together? Offering what the market needs. With a little stretch of my imagination, again going into the world of Marvel comics, I can probably equate this to a Superman and a Batman or a Spider-Man and Hulk, coming together, kind of a story, where we all probably know, when these forces come together, it's not just a sum of parts, but it's force multiplier, right? So that's the way I look at it. Like I already talked about, all the things that LTIMindtree brings, and I think Mark wonderfully put a list of all things that Onyx so uniquely brings to the market. And so, I mean, Onyx is a market-ready, future-proof, industry-leading, and like I already said, number one in the market compliance solution, while LTIMindtree brings the strength of system integration, understanding the payer landscape. I think we already talked multiple times about how important it is for us to understand the customer's landscape, because every payer is different, like Mark just said. We need to have the knowledge of understanding all these different pieces of the ecosystem, again, not just within the organization, many times outside the organization as well. So we bring that ability to understand all of these things from our experience, plus also all the stories I told already about the successes with the complex program management, understanding integrations, and all that stuff, right? So yeah, again, like I said, I just want to say it's a Spider-Man Hulk, kind of a combination. Although I think we need to still decide who plays what role, but that's basically what the combination is.
So Manju, the way I'd give you an analogy there that sort of shows our two strengths is my daughter has just bought a house, and one of the things she's got to do is get the main breaker box switched out and a couple of fans and stuff put in. With a breaker box, you're the electrician, right? You understand the standards that we work to. We can see that data gets to where it needs to go, but you're the folks that will go and plug in and make sure that all of the connections actually work.
That's better put, yeah. Thanks, Mark.
Great. I like the analogy as well, Manju, as you were trying to describe that.